It's 104.8 Channel 4. My name is Jade and I'm joined by Dr. Dhawal Bakhda.
Yeah, good afternoon. I'm Dr. Dhawal Bakhda and I'm working as a specialist surgeon with Prime.
Yes, and you're Orthopedic Surgeon at Prime Medical Centre, Al Barari branch and Prime Hospital.
That's correct, yes.
So let's talk about knees, because a lot of people who get older, lifestyle has had an effect on their knees. Talk about that, what the impact is.
Actually speaking, the problem with the knees is no longer for the older people. And of late, we see a lot of youngsters and people in their early 30s. So, our lifestyle has a lot of impact on the knee situation. If you consider our own lifestyle, a sedentary job, most of the times behind the desk, that impacts a lot. And then you get up into a loop of weight gain. So this is an extra added pressure, a joint reaction force on the knee. So having a healthy lifestyle is essential. Regular activity and balanced nutrition does help in preventing repetitive stress on the joint and prevents injuries.
Yeah, I was just reading today that sitting too much for work is actually aging us. And I guess this is it, right? What daily habits can we do then? Sort of walking around outside, is that enough?
If you consider a routine day for a person who has a desk job, almost 90% of his time is spent indoors, sitting on the desk, driving to work, you are again indoors. So the body's circadian rhythm is affected. And in order to break out of this, it's essential to include a good 20 minutes of exercise. It could be as simple as walking or swimming or cycling, but it is essential to include exercise as a daily routine. It would be better if it can be done outdoors, but even indoor, 20 minutes of exercise on daily basis would do wonders, not only for the knee joint, but as well for the whole body. And at the same time, if someone is suffering already from knee issues or is overweight, he can start with low-impact exercises. Low-impact exercises are simple walks, cycling, or swimming, which doesn't impact directly on the knee joint. And it's essential that, isometric exercises play an important role. So this includes simple stretches, which involve stretching both the front and back of your knee and hip, which we commonly call as quadriceps and hamstring stretches. In addition to maintaining those stretch postures, making sure that if you are sitting for a long time, take a break at least once in 2 to 3 hours, walk around, stretch your back, stretch your hamstrings and quads. That would help in preventing any kind of joint stiffness to creep up.
Dr. Dhawal Bakhda. If you enjoyed the interview today, you can check it out again on our podcast section. Go to channel4fm.com. You can also download the Channel 4 app. Go to Jade's Juice and you will find the full podcast on there. It's Channel 4. It's 104.8 Channel 4. My name is Jade and I'm joined by Dr. Dhawal Bakhda, Orthopedic Surgeon at Prime Medical Centre, Al Barari branch and Prime Hospital. How long would you recommend then to go outside for to get that vitamin D? Is it 10 minutes, 20?
It is at least 15 to 20 minutes.
Okay.
And, the best time of it is in the mornings, considering the UV exposure and the intense sunlight which we have here. So early mornings, just after sunrise, for at least 15-20 minutes is the best time.
Okay. And then what daily exercises are recommended for people who have knee issues?
Yeah, so as I mentioned, there is something called low-impact exercises. So this basically, if you are doing it indoors, it could be anything like a static cycle or using a cross-trainer elliptical machine. If you are outdoors, a brisk walk is very much useful for keeping your joints mobile as well as, getting your heart rate in conducive with the normal exercising levels. And other ways of strengthening your quadriceps, hamstring and calf muscles. These are these exercises which help in stabilizing the joint. So this can be simple squats, wall squats, or simple lunges or leg presses. These target the group of muscles of the lower limbs. And it is always essential that we don't concentrate on the knee alone, but also with the hip muscles, because hip and knee is synergistic. So hip abduction exercises, it could be simple as clamshell exercises. These all in total would help in building strength and reduce the stress on the knee joint.
Amazing. Well, thank you so much. It's been really interesting to chat to you. So it's just about, it doesn't have to be hours and hours, does it, of sport? It's just about getting stood up, get outside 10, 15, 20 minutes and do your bit.
Correct. Yeah, initial phase of this problem starts with simple joint stiffness and aches and cramps. When you have this for some time and you suddenly one fine day decide to enjoy a game of football or, paddle. So what happens is if you do it all of a sudden, you are inviting injuries. So it's not something which you can directly jump into one fine day or just one weekend. It requires some amount of retraining your muscles. It requires a certain amount of stretches which you should do on regular basis to prevent injuries. Because when these kind of accidents happen, while we club them as sporting injuries, most commonly they involve the ankle and the knee. For two main reasons is lack of training around the muscles and because of the artificial clay coats. This sometimes lands up into ligament tears or meniscal injuries, which require definite treatment in terms of diagnosing it as well as then rehabilitating it with physiotherapy. And in some cases, when there is a complete involvement of a complete tear of the meniscus or of the ACL, we do advise these patients to undergo an arthroscopic procedure, which is a minimally invasive procedure which can fix the problem.
That's Dr. Dhawal Bakhda, the orthopedic surgeon at Prime Medical Centre, Barari branch and Prime Hospital. It's 104.8 Channel 4.